Is forming the course of our discussion this evening, but we're not there yet. I'm going to be having a conversation, a candid one, and we hope to get your feedback on Twitter. It is at KBC Channel 1 on Twitter, but for now, the desire for mental wellness and internal peace is driving many Kenyans into yoga and meditation. To help bridge gaps and eliminate teething problems, an innovative initiative known as Nairobiing is providing the lead in this quest. Equipped with experts and other tools needed to orient converts, Nairobiing is creating spaces for Kenyans to share experiences and jointly embark on a journey to self-discovery. Take a look.
It's very good for opening the heart chakra.
The silence is loud and the mind is where it should be.
Come back, breathe out when you come up.
The quest for well-being has brought this group of city residents to the I Hate co-working space in Nairobi's Kilimani estate. It is a combination of yoga, breathing exercises, and dance.
We direct this festival together. We also have a marketplace where there are sponsors, and we have a food court, and yeah, it's a space where people come together, have workshops together, and can be in a kind of communal space doing healing arts.
What Nairobiing is about is wellness, is discovery, is healing, is balance and grounding.
Nairobiing was established to promote wellness and self-enhancement in Kenya.
We're naturally meant to be well and full of nature, full of life, full of vibrancy, constantly replenishing, just like how nature does, you know? Just like how a tree might appear to be dead, but then it regrows, just like how the ocean just leaves the beach and then comes back. Wellness is like that.
African yoga is known to be one of the oldest forms of yoga, but why is it essential?
Wellness, I think of as the things that bring you life, the things that support your health, that bring your immune system up, that bring you sort of emotional joy, lift your spirit. You know, anything to me, anything that enlivens us, brings us life.
Nairobiing is an event that supports and promotes local businesses that advocate for wellness.
This it's using our own ciabatta.
Meet Tommaso Menin, the CEO of Arga Limited.
We love such events because we are about wellness, we are about quality and traceability, and what we try to do is to create impact where we work.
Tommaso first identified the niche after settling in Isiolo for work.
I moved to Kenya between 2014 and 2015. In 2015, that's where I based myself in Isiolo, working for an Italian NGO. After less than 1 year, I understood that what really Kenya needed was mostly those areas in the north was market linkages.
The women in the northern semi-arid areas in Kenya highly benefit from the agricultural trade-off.
We have impacted several hundreds of people in arid and semi-arid lands, and as of late, in fact, just last week, we started buying aloe leaves, yeah, in order to then process them and make it into powder, and then make it into the cosmetic products that we make. And
did you know that frankincense and myrrh are harvested here in Kenya from trees?
Frankincense and myrrh are raisins that ooze out of trees, and that's what we teach communities, to tap, right, the raisin or the gum, in the case of gum arabic, out of the trees, but we teach them how to do it sustainably.
The business has had its focus on climate adaptation, a move that is highly advocated by environmental organizations.
We created seedlings. These seedlings are then transplanted into degraded lands because aloe quite simply grows on rocks and sand. So this is one angle that we've been quite strong in, which is called landscape restoration. That's what we're trying to do within the climate adaptation angle.
The essential oils are known to be the better option for the skin.
I like to tell people, look at essential oils like the soul of a plant or a tree or a flower, right? because we are extracting the real soul, and most of the time the yield, what comes out, is very little.
Reporting for Prime Edition, I am Karen Thiongo.
That report there by Karen Thiongo just takes us to our conversation this evening on matters your mental health and the impact it has on the quality of your life. Joining us this evening and to this conversation to just give us more insight is none other than Dr. Alfred Gitonga, who is a consulting psychiatrist with the Ministry of Health. Thank you, sir, for your time.
Thank you very much.
Now, 2 pieces before that, we saw a couple that, is dealing with mental disorders. And now we're seeing this initiative to ensure that majority of Nairobians get to exercise, do yoga for mental well-being. But before we get to the details, especially in the status report of where we find ourselves as a country, let's demystify. When we say mental illness, mental disorder, what comes to mind is madness, and immediately what a majority of Kenyans understand is you're fit or you're supposed to be in Mathare. Let's start from there. Let's make us understand. Break it down.
Okay, thank you very much for that question. Mental health is a state in which somebody is able to interact with society in a healthy manner. They have internal balance and they are happy and engage themselves in things they love, and they get the passion for what they do. Whenever you have a state of internal imbalance, which could be from a mental health condition such as depression or anxiety, then your enjoyment of life naturally diminishes, and then you start expressing that outwards in the behavior that you express, and people are able to see this from just interacting with you. For example, when you meet with a person with depression, they may fake that they are actually happy, but you can see that they do not have that verve, that energy for life.
So it's a state of mind, so to speak, and how we express ourselves.
That is correct. And it all begins in the mind. To simplify, the brain works on through cells we call neurons. And these neurons usually integrate each other and communicate through things we call neurotransmitters. Now, whenever you go through extreme stress, these neurotransmitters go out of balance, and the communication between the neurons affects how your brain operates. It will affect the your emotional well-being, and that is now how we start seeing people expressing outwardly the behavior of distress from that imbalance in the brain.
Okay. Now, where do we stand as a country, given that the Mental Health Act came into effect in June this year? What strides have we made in trying to just have it together, so to speak?
Okay. Since the Mental Health Act came into effect, I would like to confirm to you right now that I am aware that one of the most ardent supporters of mental health in the country, Senator Sylvia Kasanga, has a letter that sits in the desk of the chairman of the Council of Governors, Honorable Waiguru, and it seeks to exemplify and promote what the task force, the presidential task force on mental health had recommended, which was number 1, the formation of county mental health councils. Then these county mental health councils are going to handle governance issues on all matters county related as mental health. Then the county mental health councils are supposed to be given a budget line by the counties themselves. So Senator Kasanga seeks to ask the Council of Governors, as they do their county integrated development plans, there's now a budget line to handle mental health promotion and preventive activities within the counties themselves.
What overall impact will it have on our mental health state as a country?
As a country, we are taking services closer to the people. Remember that we still operate on 2 levels of government. We have the county government system and we have the national government system. As a national government officer, my job is primarily policy and capacity building and technical assistance to these people at the counties, because the counties have the role to take care of their own people health matters related. So we have given enough policy direction to the counties. What we are waiting for is the operationalization of the county mental health councils. And once this comes into play, then we'll be able to see services being taken closer to the people.
Now, the WHO gave some very grim statistics, I think, last year and beginning of this year, indicating that 1.9 million Kenyans are either suffering in one one mental issue or the other. Where are we at as of 2022?
Let me give you the statistics that I know that we have local studies that have been investigating the current state of mental health in this republic. And like I said earlier, the numbers we have are these. Number one, we have 1% of our population suffering from a condition known as psychosis. Psychosis is what you are describing, and I apologize for using this word, madness. Number two, of the patients who are accessing services in our healthcare facilities, both private and government, 25% of all outpatients and 40% of all inpatients have one or another mental health condition. Number three, according to the Global Health Observatory study by the World Health Organization, 10.8% of the Kenyan population has one mental health condition or another. Let me give it to you in numbers. 10.8% of our population, if we use the average population of 50 million, we are looking at 5.4 million individuals who are suffering, and they are not, they have one or another diagnosable condition.
4.4.
5.4 million.
5.4.
Yes.
Million.
Yes.
That's quite a population. Why do you think this is happening in this day and age?
Okay. Mental illnesses by their very means have what we call social determinants that cause people to get ill. Let me give you the statistics. Number one, unemployment. A third of our population, live below the poverty line. That is less than $1 per day per family. Number two, unemployment. 40% of the youth population in this country is unemployed. We have the highest unemployment numbers in East Africa. That leads to a lot of depression and a lot of anxiety. Number three, we have gender-based violence issues, like is reported in the media from time to time. And this has been leading to a lot of acrimony in families, and that sustained friction causes the people involved to get mental health conditions. Number four, we have a lot of trauma that people are enduring because of the things like, let me mention the 2007-2008 post-election violence. Do you know that 62% of the displaced people during that period developed post-traumatic stress disorder? Gambling. I have said over and over again that we have a gambling epidemic in this republic, and the gambling operators have refused to assist their users because their users are going into depression because of their mounting debt that they accrue. And last and finally, we need not forget that we are living in the era of the COVID-19 pandemic. COVID-19 escalated mental health conditions to obscene numbers, and that is why we are seeing such a high prevalence of mental ill health amongst our population.
Now, in this population, 5.4 million is not a walk in the park. That's quite a population. Which demographic is highly affected when it comes to matters mental health?
When it comes to matters mental health, the youth between the ages of 15 and 25 are suffering the most.
Is it the same male, female, or because I remember when you brought up that issue of COVID-19, there was a survey that was carried out among the universities, and it showed there was a lot of gender-based violence, and most often we found that the perpetrators were rather male. Now they're rather, with a few numbers being female counterparts. So does this number still apply, or is it just general?
I should believe that the male population is more affected than the female population.
Now, talking about affecting, there's another issue that has cropped up, and it is all tied to matters of mental wellness. The high rate of suicide that we are witnessing in the country. Life is priceless, but now that's a price that a majority or significant number is willing to pay.
Suicide by its very nature, and we'd like to correct the media that we should be saying died by suicide.
Died by suicide.
Not committed suicide. It's not an act of commission. It is a result of distress. So the numbers we have at the ministry from a World Health Organization sponsored study is that we have 4 suicide deaths in Kenya on a daily basis, but they are underreported. Case being, suicide is a criminal offense. Number 2, there is a lot of stigma amongst families, so they will not want to confess that one of their own died by suicide. And I would like to let you know that as a division, we have really participated in a lot of advocacy so that we can decriminalize suicide. Suicide is not a crime. It is a mental health condition. So we should not arrest them. You know, if you are arrested for trying to commit suicide, it is a 2-year jail term, a fine, or both. So the Kenya Psychiatric Association, together with the Kenya National Human Rights Commission, and a very ardent advocate of mental health, who is a person with lived experience because she has suffered from bipolar for a long time and is a personal patient of mine, Charity Moturi, have a petition at the High Court right now to declare that Section 226 of the Penal Code, which is the one that criminalizes suicide, is declared unconstitutional.
This is the numbers of suicide?
No, there are multiple strategies that the ministry has embarked on to reduce the rate of suicides in the country. Number one, we have launched the suicide prevention strategy just in the month of August. We celebrated the World Suicide Prevention Day on the 10th of September. In the suicide prevention strategy, we have collaborated with the Ministry of Agriculture, and one of our interventions is restricting access to the means of committing suicide. And this usually happens mostly through ingestion of pesticides. Number two is that the policy by the ministry aims to reduce deaths by suicide by 10% by the year 2026. It is a matter we are taking very seriously. And as we speak, capacity is being rolled over to the counties, like I said, because the document already exists. Now, implementing and seeing the results of any policy takes around 5 years for you to see real change after implementation.
We'll be keeping tabs on that. The earmarked year is actually 2026, so give or take, we have around 3 years to see that come to fruition. Now, on an individual level, away from matters of policy, from where you sit as a psychiatrist, what are the triggers? What triggers should someone be looking out for?
Okay. I am an ardent advocate for self-discovery and knowledge of thyself. So it is that you are aware when you go out of balance, when you are unhappy, when you start feeling sad. And signs of mental illness sometimes are very predictable. One could be somebody sleeping too much. Another could be somebody sleeping too little or not getting any sleep at all.
Insomnia?
Insomnia.
Okay.
There is eating too much. Another one could be not eating at all and lack of appetite. But anytime you feel that your mood is low and you are sad and you start questioning your self-esteem and you start feeling unworthy, and then your emotional and psychological state is that you are not enjoying things you used to enjoy. Biggest trigger, you find somebody not enjoying the things they previously enjoyed. If you loved watching movies, you no longer even get any peace from an activity that caused you happiness before. So self-knowledge, self-mastery is the key.
Now, Daktari, other than where do I seek help now that I've known I have a problem?
Yes.
Supposing that I have a problem, where do I seek help?
We are, the numbers we have on capacity is that we have professionals being posted to every county to assist people who may be in need. As I speak right now, we have 52 psychiatrists in government service. We have 97 student psychiatrists at the University of Nairobi. We have another 20 university students who are doing their masters in psychiatry at the Moi Teaching and Referral Hospital University, Moi University. So we are in the process of increasing the capacity of professionals to assist people. That aside, we have 16 government health facilities that have inpatient services, 16. And the government always collaborates and synergizes efforts with the people in the faith-based organizations and private providers. And it is upon the patient or the person who feels like they need help to take care of their own initiative and look for the professionals because they are there. Furthermore, the Kenya Red Cross has done a very good thing. The Kenya Red Cross has an emergency toll-free line for anybody who is in distress. The number is 1199. If you call the number 1199 and for any reason you are in psychological distress, they offer what we call psychological first aid. You know, like when you get an injury, a regular physical injury, the first aid where you are cleaned out with an antiseptic or something like that to prevent it becoming worse. Now we have what we call psychological first aid. Yes, you get emotional first aid, and if you're in distress, at least we get to see that you live another day.
Is mental health services actually covered under the NHIF?
Very good question. I really feel that we as a division of mental health, led by my director, Dr. Simon Jogona, have been engaging the NHIF to increase their funding for covering mental health conditions. Let me surprise you. Do you know that if you're admitted in a level 4 facility in Kenya with a general medical condition, they pay 3,000 shillings for your bed every day? If you are admitted and the diagnosis just changes and they write a psychological or a psychiatric condition, they only pay 1,000 per day. There is a lot of what we call iniquity in means of coverage. Number two, if you are to access outpatient services for mental health under the NHIF, they only pay 1,400 shillings per person per year, which is not enough to cover the drugs, the psychological first aid, the counseling services after that, you know, and aftercare. So we encourage Kenyans in the last talk to take NHIF cards to cover themselves, just in case they need to access mental health services. Okay. The current uptake of the NHIF is at 16%, but we are continuing to advocate for the NHIF to consider mental health to be like any other mental health, any other physical condition. Why are they discriminating against patients with mental illnesses? That is the question I want to ask them.
Good question. Now, we also want to ask you, tomorrow is the World Mental Health Day, and the theme is mental health in an unequal world. What should Kenyans expect? Okay,
in answering that question, I would expect that Kenyans realize that stigma and discrimination is one of the things that really stands in the way of patients with mental health conditions accessing care. So the inequality in mental health is because of the stigma. So we will be passing a message that mental health conditions are diseases like any other. Please do not stigmatize people with mental health conditions. And I'm happy that you have run a feature of a couple that got married the other day, and both of them have admitted openly that they have a mental health condition. So let us end stigma against mental health conditions.
Indeed. That has been our guest this evening, as we have been discussing matters of mental health and the impact it has on your quality of life. The number to share in the event that you find yourself in distress, or psychological distress, so to speak, is 1199. You're going to get first aid, and take home is that we shouldn't stigmatize anyone who finds themselves in this situation, given that the statistics as they are is 5.4 million of us Kenyans are suffering are suffering a mental disorder of